Well, as we've been hearing, the World Health Organization tonight classed this latest mutation as a variant of concern, giving it the name Omicron. Let's speak now to Dr. Catherine Smallwood. She's Senior Emergencies Officer and COVID-19 Incident Manager at the WHO. Dr. Smallwood, thank you very much. From the information that the WHO has put out tonight, the first specimen was found on the 9th of November. What work has been going on since then to try and find out more about this variant?
Good evening, and as you say, it's only a couple of weeks ago that this variant really emerged on the picture, and since then, it was only actually a few days ago that it was first put on the open access sequence platforms that virus sequences are shared with for scientists to look at. So it's really this week that this has really come to our attention at the international level. And there's a lot of work already going on, a lot of information being shared, especially from our South African colleagues. And I think that is something that we really have to recognize, the openness, the transparency, and the meaningfulness of sharing this information will have a global implication. Catching this early has been important.
As all countries have found, and some have learned this to their cost when perhaps certain countries have not been as open about information, not just of new variants, but for instance, case numbers. And then in the end, they've paid a heavy price, sometimes for not being, but also in this case, sometimes for being very candid. In terms of the information that's been supplied, what are the concerns about this variant? What is it that's making people go, hang on a minute, because there have been lots of mini variations. Why is this bad enough to be given its own name and for people to be so anxious about?
That's right. It's particularly worrying because based on its mutation profile, it looks quite different and significantly different. It has 32 mutations around the spike protein. So that's the area of the virus that is really important in the way it transmits and enters our cells when it infects us. And some of these mutations we know about because we've seen them in other variants. But other mutations are totally new. And it's this constellation of mutations that we don't really understand very well yet. So that's why it's of particular concern at the moment. And of course, we're also looking at the transmission patterns in South Africa, where it has seemed to displace the Delta variant, which is or had been dominant in all of the country.
Yeah. Yes, right. Case numbers rising. I see from the WHO information in all the provinces in South Africa. The WHO also says there is preliminary evidence of an increased risk of reinfection. So is that of people who've already had COVID?
Yes, that would be, and that's basically because some of those mutations are mutations that are associated with immune escape. So that might mean people who have previously had COVID-19, and it might also mean, but we don't know this for sure yet, that there may be a decrease in the effectiveness of the vaccine. That's not to say the vaccines won't be effective at all, but there may be a decrease, as Delta saw a decrease from Alpha, for example.
Dr. Catherine Smallwood from the World Health Organization, the Senior Emergencies Officer and COVID-19 Incident Manager there. Thank you so much for being with us in Copenhagen tonight.
You're welcome. Good night.
Good night.